We provide a health and adult social care service for a population of approximately 500,000 people.
We care for people in the hospital, the community and at home.
We excel at what we do. We have many award-winning individuals, teams and services.
We are one of the country's top performing trusts.
We support our employees to do great things.
Our teams are really motivated to improve care for patients and they're willing to work incredibly hard to make that happen.
We always put our patients first.
I provide nutritious food to help patients' recoveries.
We put systems and procedures in place to make care safer.
We return accurate test results so that treatment can start as quickly as possible.
We measure our performance and act on the facts to improve the quality of what we do.
I look after patients by getting them where they need to be on time.
I, along with 800 other volunteers, give up our time to support local hospitals.
We show compassion in everything we do.
We always follow best clinical practice.
Recruit people who share our values, enabling us to provide the highest quality care to our patients. We have hundreds of staff at any one time undertaking vocational and academic learning.
So I chose Northumbria for my foundation training as my first choice because I found it was a very friendly place to be as a student. There tends to be a lot of passionate and young, enthusiastic consultants that are very keen to teach.
Each week you come in, you're coming away with more experience, more confidence. You're just happier with the job that you're doing.
There's a really great team morale here amongst the juniors, especially as a lot of the foundation doctors rotate through A&E. You sort of feel as if you're in it together, and that side of things really makes the work a lot more fun, so it's an enjoyable place to work.
We'll have a wide range of training opportunities from apprenticeships to master's level across the organisation. These are delivered on an individual, team or bespoke basis.
My apprenticeship in Northumbria Healthcare, I believe, gave me this really valuable experience and qualifications. My overall experience has been amazing.
Our apprentices, when they're finished on completion, over 95% of them achieve substantive posts within the organisation. So we like to grow our own at Northumbria.
We regularly run highly acclaimed leadership development programmes within the organisation. These are evaluated really well and help us develop our leaders for the future.
I got to experience firsthand the golden thread running through the trust of top quality patient care in all areas.
I think all staff of all levels can come into this organisation and make a real difference. We listen and we equip leaders at all levels with the right skills to improve, and we help them spread their good ideas right across the trust.
We have an initiative which is trust-wide, which is about providing compassionate, dignified care to all of our patients. This initiative is everything from how we recruit, induct and train our staff.
There's been massive improvements made on ward nights and shared purpose. We've specifically looked at our day room and made that dementia friendly, and also with the extra training for the staff, there's been excellent improvements with communication with dementia patients also.
I worked with one ward team to help them improve the quality and safety of their handover. Together we devised a system that was so successful it was decided to roll it out across the whole organisation.
As an orthopaedic physiotherapist, I've been involved in a project which aims to improve outcomes and reduce recovery times for our joint replacement patients. I've been supported by the Quality Council to take this learning not only throughout our trust, but also nationally as well.
We have a broad portfolio of clinical trials, and some of our particularly research active specialties include Parkinson's disease, stroke, orthopaedics, respiratory and oncology. It's not just about clinical trials, it's about working with staff of all disciplines across the organisation who have an idea that matters a lot to them. We can work with those people to try and turn their idea into a research study.
We expect everybody who works for the Trust to treat patients and fellow staff members with dignity and respect. The Trust are in the top 100 Stonewall Workplace Equality Index as an employer who has good practice around employing lesbian, gay, bisexual people. We also run a number of staff network groups for people with disabilities and people who are lesbian, gay and bisexual.
The Trust charity Bright Northumbria was set up in 1998, and through the charity the Trust is able to provide the many extras that make a real difference to our patients.
Well, we've had a link with Kilimanjaro Christian Medical Centre in northern Tanzania since 1999. Over that time we've made more than 30 visits. Particular areas that we've been involved with training is keyhole surgery, burns treatment and also ultrasound training. We've also been involved in research in northern Tanzania and have done groundbreaking work in relation to stroke, Parkinson's disease, epilepsy, fluorosis and other neurological conditions.
We're working with families to prevent hospital admissions and future long-term health conditions by promoting a healthy lifestyle and physical activity.
I've come along with my 5-year-old daughter Ellie. Every week you come here, you see the kids with big smiles on their faces and the parents are learning from it as well, and there's a lot of interaction and you're seeing kids who are just learning about their own health and how to eat correctly. Overall, what this programme has changed is that eating healthier is the way ahead.
We have a very strong board of directors. They are here to provide leadership, direction and scrutinise all of the safety, quality and performance reports we produce. Their job is to help us to provide the best possible healthcare that we can for all the patients that we serve. We also have a Council of Governors. This comprises both staff and public representatives. They are there to help and support us in the work that we do.
We are the voice of the staff and regularly feedback their views to our Chief Executive and have input into the strategic direction of the Trust.
We represent the views of the public and recognise the importance of true engagement and use these views to influence the Trust's priorities.
We hold the board to account for the decisions they take through our strong relationship and by working in collaboration with each other.
We're passionate about staff experience and want them to talk to us. We know if staff feel positive, it impacts significantly on patient care.
My son's been here for 3 days now on the children's ward. He's been really well looked after and cared for. All the nurses have been friendly and the food's been fine. He's quite happy.
I would recommend that anybody would come here to have the babies. The staff are brilliant and I couldn't have coped without them.
I came here from being a student and I felt very welcome straight away. It's a great team that I work in. It's just amazing to work here.
There's a lot of good nurses here and I want to be one of them in the future.
Every day can be new challenges and new opportunities.
Everybody's very, very positive and we've all got the same vision.
I love being a research nurse and it's great working for the Trust.
It's an excellent trust to work for. I think it really looks out for the well-being and the safety of all its patients, and I think it also really looks out for the well-being of all its staff also.
The best thing about working here is that I'm allowed to make a difference.